For decades, we've been told that blood pressure is simply two numbers: the top systolic reading when your heart beats and the bottom diastolic reading when your heart rests between beats. Medical professionals have focused intensely on these figures, prescribing medications and lifestyle changes to keep them within standard ranges. But here's what most doctors aren't telling patients over 70. There's a third measurement that may be even more critical for your health and longevity, yet it's consistently overlooked in routine checkups. This reading, called pulse pressure, could be the key to understanding your true cardiovascular risk and preventing serious complications that standard blood pressure monitoring often misses. Hoy, quiero compartir con ustedes por qué esta medida ignorada importa más a medida que envejecemos, cómo revela peligros ocultos que las lecturas tradicionales no pueden detect, and most importantly, what you can do to optimize it naturally. The information I'm about to reveal could literally save your life and help you maintain independence and vitality well into your 80s and beyond. When you're 70 or older, your cardiovascular system has undergone decades of natural changes. The arteries that were once flexible and elastic have gradually stiffened, a process called arteriosclerosis. This isn't necessarily disease, it's a normal part of aging that affects everyone to some degree. However, this stiffening creates a unique problem that standard blood pressure readings can't adequately capture. Think of your arteries like garden hoses. When you're young, they're like new, flexible rubber hoses that expand and contract smoothly with each heartbeat. As you age, they become more like rigid metal pipes. When your heart pumps blood into these stiffer arteries, it creates a much more dramatic pressure wave. This is where pulse pressure becomes crucial. Pulse pressure is simply the difference between your systolic and diastolic readings. Por ejemplo, si su presión arterial es 160 sobre 80, su presión de pulso es 80. In younger adults, a normal pulse pressure ranges from 30 to 40. But after 70, this number often creeps upward, and here's why that matters tremendously. A widening pulse pressure indicates that your arteries have lost their ability to cushion the force of your heartbeat. Each time your heart contracts, it sends a powerful wave of pressure through increasingly rigid vessels. This creates excessive stress on delicate organs like your brain, kidneys, and eyes. The systolic pressure shoots higher because the arteries can't expand to accommodate the blood volume, while the diastolic pressure often drops because the vessels can't maintain pressure between heartbeats. Most physicians focus on getting systolic pressure below 140 and diastolic below 90, which seems reasonable on the surface. But here's the hidden danger. You could have a blood pressure reading of 150 over 60, which gives you a pulse pressure of 90. That systolic reading of 150 might prompt your doctor to increase medication or suggest lifestyle changes. However, they're likely missing the bigger picture entirely. That pulse pressure of 90 is screaming that your arteries are dangerously stiff, putting you at significant risk for stroke, heart attack, and cognitive decline. Research from the Framingham Heart Study, which has followed participants for over 70 years, reveals that pulse pressure is actually a stronger predictor of cardiovascular events in older adults than either systolic or diastolic pressure alone. In people over 65, every 10-point increase in pulse pressure increases stroke risk by approximately 15%. Even more alarming, a pulse pressure above 60 in seniors doubles the risk of developing dementia compared to those with normal pulse pressure. The reason this measurement is so predictive lies in what it reveals about your arterial health. When arteries are stiff, they can't perform one of their most important functions, smoothing out the pulsatile flow of blood from your heart. En saludable, flexible arterias, las paredes de los vasos se expanden durante la sistole para acomodar la sangre entrante, luego se contraen durante la diástole para mantener un flujo constante. This creates relatively steady pressure throughout your circulatory system. But when arteries are rigid, this smoothing effect is lost. Instead, your organs experience dramatic pressure swings with each heartbeat. Your brain, which requires incredibly steady blood flow to function properly, bears the brunt of this assault. The high-pressure waves during systole can damage delicate brain capillaries, while the low-pressure periods during diastole may not provide adequate perfusion to brain tissue. Over time, this leads to what researchers call silent strokes, tiny areas of brain damage that accumulate and gradually impair cognitive function. Your kidneys face similar challenges. These organs filter your blood through millions of tiny vessels that are exquisitely sensitive to pressure changes. When pulse pressure is elevated, the kidneys experience alternating periods of excessive pressure and inadequate flow. This damages the filtration system and accelerates kidney aging, even when overall blood pressure appears well controlled. The eyes present another target for pulse pressure damage. The retina contains some of the smallest blood vessels in your body, and they're particularly vulnerable to pressure fluctuations. Elevated pulse pressure can cause these vessels to leak or rupture, leading to vision problems that develop gradually and often go unnoticed until significant damage has occurred. Perhaps most concerning is the effect on your heart itself. While your heart creates the pressure waves, it also suffers from them. The left ventricle, which pumps blood to your entire body, must work much harder when arteries are stiff. This increased workload leads to thickening of the heart muscle, a condition called left ventricular hypertrophy. A thickened heart is less efficient at pumping blood and more prone to dangerous rhythm disturbances. Now, you might wonder why your doctor hasn't mentioned pulse pressure if it's so important. The truth is, most medical training still focuses heavily on the traditional approach to blood pressure management. Many physicians were taught to treat the systolic and diastolic numbers independently, without considering what the relationship between them reveals. Additionally, pharmaceutical companies have invested billions in developing medications that target overall blood pressure, not specifically arterial stiffness. This creates a frustrating situation where patients receive medications that may lower their blood pressure readings on paper, while doing little to address the underlying arterial stiffness that's causing the real damage. Beta blockers, for instance, can effectively lower heart rate and reduce systolic pressure, but they may actually worsen arterial stiffness in some patients. ACE inhibitors and calcium channel blockers tend to be better choices for pulse pressure, but the decision is rarely made with this specific goal in mind. The good news is that arterial stiffness isn't entirely inevitable, and there are proven strategies to maintain or even improve arterial flexibility after 70. The most powerful intervention is regular aerobic exercise, but the type and intensity matter enormously. Research shows that moderate intensity exercise performed consistently is far more beneficial for arterial health than sporadic high-intensity workouts. Walking remains one of the best exercises for seniors, but the key is maintaining a pace that elevates your heart rate to about 60 to 70% of your maximum. For most people over 70, this means walking briskly enough that you could still carry on a conversation, but you'd prefer to pause occasionally to catch your breath. Aim for at least 30 minutos de esta clase de actividad la mayoría de los días de la semana. Swimming proporciona beneficios excepcionales para la salud arterial porque la presión hidrostática del agua ayuda a mejorar la circulación mientras reduce el estrés en las articulaciones. The rhythmic nature of swimming strokes also helps train your cardiovascular system to handle varying pressure loads more efficiently. Water walking or aqua aerobics can provide similar benefits for those who aren't comfortable swimming laps. Resistencia a entrenamiento, cuando se hace correctamente, también puede mejorar la función arterial. The key is using lighter weights with higher repetitions rather than heavy lifting that creates dangerous pressure spikes. Resistance bands, light dumbbells, or bodyweight exercises performed in a circuit format can help maintain muscle mass while supporting cardiovascular health. Yoga and Tai Chi deserve special mention because they combine gentle movement with breathing techniques that specifically benefit arterial function. These practices help activate the parasympathetic nervous system, which promotes relaxation and allows arteries to function more efficiently. The slow, controlled movements also help train your body to manage pressure changes gradually rather than experiencing sudden spikes. Nutrición juega un papel igualmente importante en mantener la flexibilidad arterial. The Mediterranean diet has been extensively studied and consistently shows benefits for vascular health. This eating pattern emphasizes olive oil, fatty fish, nuts, seeds, fruits, vegetables, and whole grains, while limiting processed foods, refined sugars, and excessive red meat. Omega-3, ácidos grasos de aceite de pescado o suplementos a base de algas pueden ayudar a reducir la inflamación en las paredes arteriales, haciéndolas más flexibles. The research suggests that approximately 1,000 to 2,000 milligrams daily of combined EPA and DHEA provides optimal benefits. However, quality matters enormously with fish oil supplements, as many contain rancid oils that can actually promote inflammation. Magnesium is perhaps the most underrated mineral for arterial health. This nutrient acts as a natural calcium channel blocker, helping arterial muscles relax and maintain flexibility. Most people over 70 are deficient in magnesium due to decreased absorption and increased losses through medications like diuretics. Foods rich in magnesium include dark leafy greens, nuts, seeds, avocados, and dark chocolate. Supplementation with magnesium glycinate or magnesium taurate may be beneficial, typically in doses of 300 to 400 milligrams daily. Potassium trabaja sinergísticamente con magnesio para apoyar la función arterial. This mineral helps counteract the stiffening effects of sodium and supports healthy blood vessel tone. Bananas are famous for potassium, but avocados, white beans, sweet potatoes, and coconut water are even richer sources. Many seniors need to be cautious with potassium supplements if they take certain heart medications, so food sources are generally preferred. Vitamin K2 ha emergido como un nutriente crucial para la salud arterial que la mayoría de la gente nunca ha oído hablar. This vitamin helps prevent calcium from depositing in arterial walls, a process that contributes significantly to arterial stiffening. K-dose is found in fermented foods like natto, aged cheeses, and sauerkraut, but supplementation may be necessary to achieve therapeutic levels. Hydration status dramatically affects pulse pressure, yet dehydration is extremely common in seniors. Incluso una leve deshidratación puede aumentar la rigidez arterial y empeorar la presión arterial. The challenge is that thirst sensation diminishes with age, and many seniors reduce fluid intake to avoid frequent bathroom trips. The solution is to sip small amounts of water consistently throughout the day rather than trying to drink large volumes at once. Sleep quality profoundly impacts arterial function through its effects on stress hormones and inflammation. Durante el sueño profundo, tu sistema cardiovascular tiene la oportunidad de reparar y regenerar. Poor sleep elevates cortisol and inflammatory markers that directly contribute to arterial stiffening. Creating a consistent sleep schedule, keeping your bedroom cool and dark, and avoiding screens before bedtime can significantly improve sleep quality. Stress management cannot be overlooked when addressing arterial stiffness. Chronic stress keeps your sympathetic nervous system activated, which promotes arterial constriction and stiffening over time. Simple breathing exercises, meditation, spending time in nature, or engaging in enjoyable hobbies can help activate your parasympathetic nervous system and allow your arteries to relax. Temperatura extrema, particularmente la exposición al frío, puede agravar temporalmente la rigidez arterial en los ancianos. This doesn't mean you should avoid cold weather entirely, but it does mean taking precautions. Dress warmly, allow time for gradual temperature adjustments, and avoid sudden exposure to very hot or cold conditions. Certain medications commonly prescribed to seniors can worsen arterial stiffness without doctors realizing it. Some blood pressure medications, particularly older beta blockers, can actually increase pulse pressure even while lowering overall blood pressure. Anti-inflammatory medications like ibuprofeno pueden promover la retención de sodio y la rigidez arterial. If you're concerned about your medications, discuss alternatives with your physician rather than stopping anything abruptly. Smoking and exposure to secondhand smoke are among the most damaging factors for arterial health. The toxins in cigarette smoke directly damage the endothelium, the inner lining of your arteries, making them stiff and prone to dangerous plaque formation. Even if you've smoked for years, quitting at any age provides immediate and long-term benefits for arterial function. Excessive alcohol consumption can worsen arterial stiffness, but moderate consumption, particularly red wine, may provide some protective benefits. The key word is moderate, which means no more than 1 drink per day for women and 2 for men. The antioxidants in red wine, particularly resveratrol, may help maintain arterial flexibility. Regular monitoring of your pulse pressure is something you can do at home with a good quality blood pressure monitor. Take readings at the same time each day, preferably in the morning before medications or coffee. Calcula tu presión arterial pulsátil restando la diastólica de la sistólica. Keep a log and look for trends over time rather than focusing on individual readings. Si tu presión arterial sistólica supera los 60 o si notas que aumenta con el tiempo, esto amerita una discusión con tu proveedor de atención médica. Don't just accept that arterial stiffening is inevitable with age. Hay intervenciones médicas que pueden ayudar, incluyendo medicamentos específicos que apuntan a la rigidez arterial en lugar de simplemente reducir los números de la presión arterial. Advanced testing can provide additional insights into your arterial health. Pulse wave velocity testing measures how fast pressure waves travel through your arteries, providing a direct measurement of arterial stiffness. Ankle brachial index testing can reveal peripheral arterial disease that contributes to pulse pressure problems. These tests aren't routinely ordered, but they can provide valuable information for optimizing your cardiovascular health. The connection between arterial stiffness and cognitive function deserves special attention because it's one of the most preventable causes of age-related mental decline. When your brain receives steady, adequate blood flow, it can maintain and even build new neural connections well into your 80s and 90s. But when pulse pressure damages the delicate blood vessels feeding your brain, cognitive decline becomes almost inevitable. Recent research has identified pulse pressure as a modifiable risk factor for Alzheimer's disease and other forms of dementia. This means that by taking steps to maintain arterial flexibility, you're not just protecting your heart and kidneys, you're also preserving your mental sharpness and independence. The key insight here is that your pulse pressure reading reveals information about your true biological age versus your chronological age. Someone who is 75 with excellent arterial flexibility and normal pulse pressure may have the cardiovascular system of a 50-year-old. Conversely, a 60-year-old with significant arterial stiffness may have the vascular age of someone 20 years older. This biological age concept is empowering because it means you have significant control over how your cardiovascular system ages. The lifestyle interventions I've described can literally reverse arterial aging in many people. Studies show that consistent aerobic exercise, proper nutrition, stress management, and adequate sleep can improve arterial flexibility even in people who have experienced years of stiffening. The timing of these interventions matters, but it's never too late to start. People who begin exercise programs in their 70s and 80s still show measurable improvements in arterial function within just a few months. The body's ability to adapt and heal continues throughout life, even when damage has already occurred. However, the earlier you start, the more dramatic the benefits. If you're reading this in your 60s or early 70s, you have an enormous opportunity to prevent the arterial stiffening that leads to so many health problems later in life. But even if you're already dealing with elevated pulse pressure, the strategies I've outlined can help slow progression and may even reverse some of the damage. Understanding pulse pressure also helps explain why some people seem to age more successfully than others. Those individuals you know who remain sharp, energetic, and independent well into their 80s often have one thing in common. They've maintained excellent arterial health, whether through genetics, lifestyle choices, or both. The most encouraging aspect of this information is that pulse pressure responds relatively quickly to positive changes. Unlike some aspects of cardiovascular health that take months or years to improve, arterial flexibility can begin improving within weeks of starting un programa de ejercicio apropiado o haciendo cambios en la dieta. Your pulse pressure reading is essentially a window into the health of your entire circulatory system. It reflects not just your current cardiovascular status, but also provides insights into your future risk for stroke, heart attack, kidney disease, and cognitive decline. Most importantly, it's a measurement you can influence through your daily choices. The tragedy is that millions of seniors are walking around with dangerously elevated pulse pressure, completely unaware of their risk because their doctors are focused solely on traditional blood pressure numbers. These individuals could benefit enormously from targeted interventions, but they never receive the information or guidance they need. As we age, it becomes increasingly important to look beyond simple measurements and understand what our bodies are really telling us. Pulse pressure is one of the most valuable pieces of information your cardiovascular system can provide, yet it's hiding in plain sight on every blood pressure reading you've ever received. Taking control of your pulse pressure means taking control of your cardiovascular destiny. It means choosing to age with vitality rather than accepting decline as inevitable. Most importantly, it means giving yourself the best possible chance of maintaining independence, mental clarity, and quality of life for years to come. The next time you have your blood pressure checked, don't just ask about the top and bottom numbers. Ask about your pulse pressure. Calculate it yourself, track it over time, and remember that this single measurement may be more important for your long-term health than either of the numbers your doctor typically discusses. Your arteries don't have to stiffen with age. Your pulse pressure doesn't have to increase. With the right knowledge and consistent action, you can maintain cardiovascular health that rivals someone decades younger. The choice and the power is entirely in your hands.